Hello, thank you for tuning into Kaieteur Radio. I am Kevin Smith and welcome to your news at noon. These are the top stories we're tracking. 6 years later, Guyana has almost zero institutional human capacity to manage oil industry. Dr. Mangal says situation benefits oil companies and harms the country. Guyana yet to use UNDP recommendations to avoid corruption and oil sector abuse, and brawl at psychiatric hospital leaves one dead, another injured. Meanwhile, trio to stand trial in High Court for killing Better Hope money changer and his daughter, and fake job seeker robs businessman and cop and captured after movie-style getaway. Meanwhile, multiple organizations donate to CDC flood relief efforts. Do stay tuned to stay informed.
Join Guyana's first extractive sector transparency virtual forum from June 7 to 11 for an opportunity to learn about and discuss Guyana's ongoing pursuit of good governance and transparency in the extractive sector. The week-long forum would feature local and international presenters and highlight resources and tools to strengthen transparency, increase advocacy, and provide opportunities for sharing knowledge and experiences about Guyana's extractive sector. Hear from the Minister of Natural Resources, the Honorable Vikram Bharat, Ambassador of the United States of America, Sarah Ann Lynch, and experts in the field. Register now at geitw@padf.org. Sponsored by USAID, implemented by Pan American Development Foundation.
And now for the news in detail. Having found oil since May 2015, Guyana finds itself in a position today where it has almost zero institutional and human capacity to manage the growing industry. Sadly, such a conundrum only benefits oil companies and harms the country. Expressing these sentiments recently was former presidential advisor and international petroleum consultant Dr. Jan Mangal. Dr. Mangal added that Guyana would need much more than a petroleum commission. He said it would also need a comprehensive framework with new bills, laws, policies, regulations, and associated institutions. Unfortunately, the country remains relatively miles away from getting all these safeguards in place by year end. In other news, in response to a request in 2016 to help Guyana arrive at good legal, regulatory, contractual, and fiscal measures needed to keep corruption at bay, the United Nations Development Programme, or UNDP, had commissioned an analysis to be done on the state of the nation's governance systems. The subsequent report was produced by Trinidadian energy strategist Anthony Paul. However, after 5 years of being in possession of this document, which proposes close to 100 critical recommendations on how Guyana must safeguard itself, nothing has been done. That report was keen to note that the requirements and expectations of the government to manage this sector, especially when one considers the magnitude of the resources discovered, are enormous. And now let's tell you the National Psychiatric Hospital located at 4 Kanji Berbice is currently under the spotlight after a patient was killed and another injured during a recent fight among inmates. Dead is 41-year-old Ryan Sothgalam. The injured patient, who has since been released, was identified as 38-year-old Steve Roberts. Based on the events leading up to the untimely death of Sothgalam, Regional Chairman David Armagan disclosed that the patient ripped out a window and grillwork and used it to inflict injuries sustained by the now dead man. Regional Health Officer Dr. Sharma also revealed that Robert sustained injuries during the same altercation at the facility, but he could not say what was used to cause his injuries. It is understood that there was one nurse on duty at the time when the incident occurred, and she removed herself from the hospital situation to seek help from other colleagues. And now let's tell you, over the past week, the Civil Defense Commission, or CDC, received multiple donations from various businesses and organizations to assist with its flood relief efforts. Recently, eNetworks, Guyana's leading provider of digital cable television, donated $1 million to the CDC in support of flood relief efforts countrywide. Tiger Rentals, a leading international provider of specialty rental equipment to the upstream offshore oil and gas market, donated over $650,000 yesterday to the CDC in support of the flood relief effort countrywide. Innovative Mining Inc. also made its contribution yesterday as it handed over a check valued $100,000 to the CDC. The CDC stated that the timely response and generous donations are greatly appreciated. And on that note, let's tell you Magistrate Alicia George yesterday committed 3 men to stand trial in the High Court for the murder of Better Hope money changer Aaron Lachman and his 18-year-old daughter Ariana Lachman. 5 men are accused of the 2019 double murder. Those men are 25-year-old Mark Ruffino, 37-year-old Paul Chan, Troy Abrams, and Lloyd Sadlu. The 5 accused made their first court appearance on July 18, 2019 in the Sparendam Magistrates Court before Magistrate George. They were not required to plead to the indictable charge, which alleges that on July 4, 2019, at Robert Street, Better Hope, the defendants murdered the Lachmans during a robbery. You are tuned into Kaieteur Radio 99.1 and, of course, 99.5 FM. This is your news at noon. We will return after the break. Welcome back. Let us continue with the news. A bandit who robbed the businessman and a police officer of their valuables was apprehended shortly after his stunt on Thursday afternoon and placed into police custody. According to a police report, the 2 victims, a 44-year-old businessman and a 30-year-old police officer, were both working on a newly constructed house located in Good Intent on the west bank of Demerara at 16 hours 30 when the suspect approached them and made inquiries about the boss of the operation. Upon entering the building, he pulled out a black handgun and forced the victims to hand over their valuables. The police recovered all the stolen articles before the suspect was taken into the Wales police station. The other 2 occupants of the car that the suspect had joined have also been detained. The area was searched, but no firearm or any other cash was found. Investigations are ongoing. In other news, the new, upgraded and/or repaired components of the flash gas compression system for the Eliza Destiny oil vessel have arrived offshore Guyana and are being reinstalled. This was confirmed yesterday by ExxonMobil's Guyana's Public and Government Affairs Advisor Janelle Prasad. In her usual operations update, Prasad said the team remains on track to complete reinstallation and startup of the flash gas compressor later this month. In the meantime, Prasad said the company continues to safely manage flare levels to less than 15 million standard cubic feet of gas per day. And moving on, the impact of the COVID-19 pandemic on national and regional HIV programs was brought to the fore during a just concluded 3-day virtual meeting hosted by the Pan-Caribbean Partnership Against HIV and AIDS, or PANCAP. The meeting for National AIDS Program Managers and key partners, which commenced on Wednesday, also discussed how countries are coping and adjusting their program delivery during COVID-19 to ensure sustainability. PANCAP Director Dr. Rosamond Adams acknowledged that COVID-19 had exposed weaknesses in health systems at the global, regional, and national levels. Dr. Adams underscored that the epidemic is fueled by stigma and discrimination, marginalization and criminalization of communities, and lack of access to health, education, and other essential services. It is now 12 hours 24, time for a COVID-19 update. The Ministry of Health yesterday announced that 3 women who tested positive for COVID-19 have died. As a result of this, Guyana's COVID-19 death toll is now 403. According to the ministry's press release, the latest fatalities are a 36-year-old from Region 4, a 71-year-old from Region 10, and a 75-year-old from Region 3. 83 new COVID-19 cases were recorded, taking the total number of confirmed cases to 17,459. 17 patients are in the COVID-19 ICU. 105 persons are in institutional isolation, 1,772 in home isolation, and 6 quarantined institutionally. To date, a total of 15,162 recoveries have been recorded. Just before we come to the end of today's news at noon, let's head over to the page 7 of the Kaieteur News that is dedicated to being blunt. It has been over 1 year since COVID-19 entered our shores. Indeed, it continues to be a worrying pandemic given the infection and death rates. However, as devastating as it has been, the measures to safeguard ourselves have been especially simple. Embrace hygienic practices, social distance, wear a face mask, and take the vaccine when it becomes available. However, there are some among us who are convinced that those measures are way too simple, or in the case of the vaccines, they were made available too soon. While individuals are entitled to make the choice they are comfortable with, there must be no blurred lines when it comes to the role each of us must play in the fight against this disease. Not alone, but together, we can annihilate COVID-19. And with that, we've come to the end of today's News at Noon. I'm Kevin Smith. Thank you for listening.
Want value for your advertising dollar? Then place your ads on Kaieteur Radio's newscasts. Streamed live on 6 different mediums, reaching hundreds of thousands. Advertise today and watch your dollar grow. Call us on 225-8465 or 226-8210 today.
It is now 12 hours 27. Coming up next, as usual, a short presentation on the oil and gas sector in Guyana from the publisher of the Kaieteur News, Dr. Glenn Lal.
Guyana giving away billions and begging for millions. I am Glenn Lal, owner of Kaieteur News and